I'm going to call to order the July meeting of the MTA Safety Committee. I'm going to start by asking Pat Warren whether there are any public speakers.
There are no public speakers at this time.
All right, thank you. I'm going to ask for approval of the minutes from the April 21st committee meeting. I'll move it. Do I have a second? Second. All in favor? Aye. The minutes pass. Pat Warren, are there any changes to the work plan?
There are no changes to the work plan.
All right, so Jason Anthony just walked in, and you'd like to speak? Good.
It's not on. The mic's not on.
Jason, turn the mic on, or if you guys could. Okay. Good morning.
Several NYPD officers and passengers alike weren't complying with the federal mandate. Patrick Warren, you're the head of safety. That said, since the beginning of COVID-19, you failed. So that means that the New York City Transit is violating, as we speak, the federal mandate that's in effect until September 13th. That could have a bad reputation agency-wise. Because if every other transit agency in the Northeast, like Washington Metro, Boston T&L, and Boston, among others, say very specific that's a federal mandate that we have to wear masks in every transportation facility, why we're not seeing it in New York City? And I want to investigate it right now. So I'll see you guys later on the full board.
Jason, thank you for those comments. Pat Warren, are there any changes to the work plan?
No changes to the work plan.
All right, good. Would you please discuss the New York City Transit safety plan with the public and the committee?
Sure. And Chairman and members, it's a pleasure to be here in person again. And before I go into that, let me just acknowledge that there's been a few changes to the safety leadership in some of the agencies. And so at Metro North, Clyde Armstrong assumed the vice president role for safety. Tim Dotto assumed the vice president role for safety in New York City Transit, and Carl Hammond assumed the position of deputy chief safety officer at the MTA. The agency safety leads are with us on Zoom today, so they'll be active in this meeting. In addition to a short statement about the New York City Transit Safety Plan, today we will update you on the status of NTSB recommendations and the MTA's drug and alcohol program. So now let me ask New York City Transit Vice President for Safety, Tim Dotto, to introduce the topic of their safety plan.
Good morning, everyone. The New York City Transit Public Transportation Agency Safety Plan that is mandated by the Federal Transit Administration for buses and subways requires board approval annually. A summary of revisions was sent along with the safety plan to this committee and to the full board for review. As many of you may recall, last year the board approved the plan for the first time, and it's now time for the annual review and board approval. At the board meeting, we'll ask for full board approval. As you read in material sent to you earlier, updates to the plan were not very significant, and I'd be happy to answer any questions.
Any questions? So I'll come for vote in the full board meeting. Thanks, Tim.
Thank you.
Okay. The recent safety statistics for each of the agencies are in the committee books, and they're found on pages 9 through 16, and were briefed by the agency committee to the agency's committees earlier this week. Overall incidents on accidents and injuries remain very low across the MTA, with the effects of COVID-19 virus being the most significant safety challenge over the last year. If you have questions regarding the statistics and safety, the safety leads are prepared to answer them. Go ahead, Andrew.
Yeah, something that seems a little out of whack to me and some others is that if you look at the customer accident rate from May 19th to April 20, it's very low. But then if you look at it from May 20, which is largely in COVID, through April of 21, it seems to have gotten higher. That's sort of.
Are you talking about a specific agency?
Oh, I'm talking about Metro North.
Okay. Clyde, are you on?
Clyde's not on, Pat. I can speak to
Sure,
that, and
yeah.
Matt Pelosi's on. He can
Sorry.
supplement. The base is just much smaller, so the actual number of incidents is down. It's actually down quite a bit, but the base is so much smaller that the number that you see in the report is actually up a bit. And the more important thing is actually what we're seeing, the kinds of accidents. There really is no commonality or anything that we're really concerned about, but really the answer for why you're seeing that jump up in terms of the index is because the base is significantly smaller in terms of the number of riders.
Got it. Thank you.
And Commissioner, that's the case with all of them. So you'll see a slight uptick in almost all, not all cases, but many cases, and that is because the denominator is just so stinking different than it was a year ago. But we'll probably see it come back into
Yeah,
normal.
like on transit, it's
Yeah.
way up as well.
Right, same issue, exact same issue. Okay. With that, no more questions. We'll go to the slides for the NTSB, if you bring those up. So every year, we go over the National Transportation Safety Board recommendations as they exist. And if you look on this slide here, you'll note of good and important note is that last year the NTSB did not perform any formal on-site investigations on MTA properties, which is great news. Further, there were no continuing investigations, and many of you may be aware that the NTSB often takes years to complete an investigation, and so at this point, all investigations that involve any of the MTA agencies are complete, which is great. And of those, we have 7 recommendations that remain open, which is also good. Over the last 2 years, we have whittled down the open recommendations from nearly 30 to just 7 right now. So that's a great progress in that regard. I'll go over these in a little bit of detail in the next slide. These are the 5 accidents that we currently still have open recommendations for. And again, I'll go over these in a little bit of detail. I'll let you take a look at this for a second, and then we'll go on. Okay, next slide, please. For recommendation 1466 through 68, the NTSB published a special investigation report which covers 5 Metro North accidents investigated by the NTSB between 2013 and 2014. And they examined some common elements and recommended to the Metro North and to the MTA actions that we should take. These actions, they address. To address the recommendations, the MTA All-Agency Safety Council was established to review safety data and direct actions to mitigate identified safety risks. This council meets weekly with the safety leads. These safety effects are witnessed by the continued improvement of the authority's safety record. Also, the ongoing MTA transformation has further built out the MTA safety program to include environment, emergency management, and occupational health. Based on these actions, MTA is preparing a letter to the MTSB requesting they close out these recommendations. Yeah.
Given all the incidents that have taken place
Yep.
with the R179s, were there no NTSB recommendations regarding that fleet?
No, you may be aware that NTSB typically only investigates incidents where
Interstate.
there's an actual injury, particularly a death, are the ones that they investigate most formally.
So they wouldn't investigate cars just coming apart by themselves, or?
It depended on how grievous it was. There are a lot of incidents around the nation, and they're not really that big of an agency, and so it's a lot for them to do.
Okay.
If you look at recommendation 1503, which is at Bridgeport, this recommendation stems from an accident where it was determined that the probable cause of the derailment was an undetected broken pair of compromised joint bars that detached the rail car from the truck assembly. The recommendation was placement of grade 5 bolts by grade 8 bolts on M8 cars to mitigate this challenge. Approximately just over 400 M8 cars have had these bolts replaced, which is essentially the entire in-service fleet for Metro North. And there are 25 new single cars that came in last year that are now getting their bolts replaced. They're largely not in service right now, and they should be complete by the end of this year. And at that point, we'll put in a recommendation to close out, a request to close out this recommendation. Let's go to the next slide. Recommendation 1933. This recommendation stems from an accident where a New York City Transit train struck 2 maintenance of way employees who were setting up flagging protection. To support the recommendation, NTSB adopted new flagging procedures, and based on these new flagging procedures, the New York City Transit has requested the NTSB to close out this recommendation too. Recommendation 2008, these are relatively new at Queens Village. In this case, this refers to the accident at Queens Village where a roadway worker was struck by a train while occupying and interlocking. The recommendations asked for on-track protections to be examined, and Long Island completed its review of its train approach warning program and applied insights for the review. They have asked the NTSB to close this recommendation. With regard to recommendation 20009, this from the same incident, the investigation by the NTSB further identified fatigue of the struck roadway worker as a factor in the accident. The NTSB asked us to work with our labor partners to identify and implement improved methods to minimize the risk of fatigue. To this end, the headquarters and the 2 railroads are working with labor to identify useful biomathematical models for fatigue avoidance. Work is ongoing right now and is expected to be completed by the end of the year. The last 2 recommendations stem from the derailment where a train crew did not take appropriate actions due to reduced track conditions. Metro North Railroad took immediate procedural steps to report and inform crews regarding changes to track conditions. The ultimate solution for this was the introduction of positive train control, which automatically relays track conditions to trains and will prevent the train from entering these areas at inappropriate speeds. As PTC was fully implemented last December, Metro North has formally requested that the NTSB close this recommendation too. That is the current outstanding recommendations for the NTSB. Are there any further questions on that?
Not to that, but back to the earlier point in the safety numbers, and I'm trying not to be as controversial or, or difficult as I can be. But I'm concerned, I've been concerned for a number of months of the explanation on the safety issues using per capita analysis and saying, look, it may be that, for instance, transit safety is up almost doubled, but look, the per capita use is way down. I'm concerned of the contradiction of using that analysis vis-a-vis crime statistics, where many times it's been pointed out, look, crime statistics are down, and the response is, well, on a per capita basis, they're up, and which is true, because with fewer riders, and it's no question to me that it's sort of bad guys haven't taken time off for COVID, and so it's not surprising that the per capita statistics would be up. It seems to me there's a contradiction in using opposite arguments and saying on the safety end, look, there's really, it's because there's so few people, and especially if you looked at, for instance, crime on the commuter rails, where crime is not down on commuter rails and ridership is way down. And I'm not arguing, I don't want to relitigate the discussion that we've had so many times, but I do think there is something of a contradiction in the arguments of explaining one saying, oh, it's a per capita issue, and on the reverse, on the safety issue, saying, oh, the problem is a per capita issue. And so I just sort of point that out. It's bothered me for a number of months, And I figured I might as well, in this conversation, express that thought, that I don't think it's consistent.
Yeah. The one thing I can tell you about these statistics, and we review them all the time in the safety council, and we are as concerned as everybody about what we're looking at and is it a quality issue? And as many of the incidents that we look at are largely very minor incidents, but we still measure them and then we still put them out there. And so as we look at what's going on in the field out there, we do recognize that the numbers are way down. We are down because there's less riders out there in terms of incidents and accidents, mostly just slips, trips, and falls. But we take everyone seriously, and then we take a look at what we can do differently in the different organizations to see if we can prevent that from happening. A lot of them are, if it's a mechanical or technical issue, in other words, like a handrail that's loose or a step that's loose or something like that, we work on it. If it's more of a teaching kind of thing where we have employees that maybe not lifting something correctly or are doing something else that puts them in some kind of strained situation, we take a look at that very closely and get them some help in that regard. So it is a topic that the team spends a lot of energy on and takes to heart every day, because it's just if this is our employees and customers, but our employees are what makes the organization run right. If we don't have them, if they're not safe and they're not be able to function, it's a big deal to us, and it impacts service. So I hear your point, and we do look at it very, very closely, and we want to make sure that we're doing right by everybody out there. No, we have one more topic. I think it's sure. Now I want to. Oh, sure. I'm sorry.
Yeah, I mean, in that regard, why are the crime statistics, or really the violence statistics, separated from the safety statistics in any way? I mean, why aren't we discussing the crime stuff here? I mean, that's a safety issue, certainly for the workers.
So I think it's a great topic, and we're actually looking to determine how to combine them, and we sort of got to go through procedural stuff there, but I agree with you on the point. I think we can do that. Okay, one other topic that we have today is to talk about our drug and alcohol program. Dr. Luisi is the lead of our occupational health, and she oversees the entire drug and alcohol program. Before she launches into that, I just want to say just how the Herculean effort that she and her team has put in over at occupational health with regard to this whole COVID crisis, from testing to vaccines to hotlines to screening records to searching for everybody out there, trying to find phone numbers. It's the amount of energy, the amount of time that they put into it is amazing, and so thank you very much for that. So could you bring up the next slide, please?
Sure. Good morning. In our unit in occupational health, we have a drug and alcohol testing program. We provide services at varying levels to each of the agencies. And the agencies that we provide the services to are New York City Transit, MTA Bus, Metro North Railroad, Long Island Railroad, and MTA Police. There are three categories in the drug testing program that we define a lot of our testing by. So we have fitness for duty. We have a deterrent program, which is the random drug testing program, and we have the rehabilitation, which is the return to duty process. So under fitness for duty, we have the pre-employment and the promotions, testing conducted before a candidate is hired. We have periodic testing, and this periodic testing depends on the agency and the standards that the agency has. So the testing can either occur annually or every 2 years or every 5 years, depending on the agency. The return to work process also is defined by the agency, and it's defined by the number of days that the employee is out. So for Metro North, it's about 14 days. For New York City Transit, it's 21 days. Long Island Railroad is 30 days. MTA Bus and MTA PD, it's 90 days. So after that amount of time, the employee must be brought back in to one of our medical facilities to be drug tested. We also have another category under the fitness for duty, which is reasonable suspicion. This is a category that is based on a supervisor's visual observation of impairment of an employee. They can send the employee into the clinic for them to be given a drug test. Post-accident is another area. This occurs when an incident meets a federal or agency threshold for the accident. The person, we will follow them either into a hospital or we will bring them in to one of our clinics. The deterrent random drug testing program, each agency has specific minimal federal testing requirements that we must follow for that agency. Those are called pools, and we need to bring those amount of people in on a yearly basis, and that will be delineated more on the next slide. For follow-up drug and or alcohol testing, which I guess is sort of also considered our second chance policy, it's basically two-pronged. It's either a voluntary program or it is one that we catch them on a random drug test. But basically, this occurs when the employee completes the return to duty process after a positive, verified positive, and a substance abuse professional counselor provides occupational health with a plan that says how often this employee will have to come in over the next certain amount of time to be continuously tested. So the random drug testing under the DOT, it varies for the different agencies. So New York City Transit, MTA Bus, and MTA Police, they all follow the FTA program, which is the Federal Transportation Administration guidelines. We have to bring in up to 50% of that population. That changed from 25% to 50% January 1st, 2019. And we also do 10% alcohol testing. The railroads, Metro North and Long Island Railroad, are covered under the FRA, which is the Federal Railroad Administration, and then they actually break it down within titles for each of the employees. So FRA for MOW, 50% drug, 25% alcohol. FRA for hours of service, 25% drug, 10% alcohol. There was a new ruling, January 20th, 2021, that they are going to now figure out when we have to implement a new group, which is for the FRA mechanical employees. The mechanical employees are the subset of people who are tested or inspecting the rail, road, and any rolling equipment on the rails. We do suspect that a lot of our titles that are already in MOW may be pulled out and put into the mechanical. But at this point, the feds have not told us when we need to begin testing that group yet. And the last category is FEMSA, which is the Federal Motor Carrier Safety Administration. This is usually our CDL folks, the commercial driver's license. And we test those folks at 25% for drugs and 10% for alcohol. So when an employee has a positive, there's a whole protocol that happens across our clinics and with the departments that we service. So a department and the employee are notified by occupational health regarding a positive. An interview is usually conducted between the employee and the occupational health medical review officer. These are specially trained physicians in our units that have additional training to be able to interpret drug testing results. A discussion is had between the employee and the medical review officer, or we call the MRO, at which point the MRO makes the determination if the employee is a verified positive, right? At that point, if it is, the employee is referred to labor relations and a stipulation agreement is finalized between the employee and their union and the labor relations department. The employee completes the mandatory EAP, Employee Assistance Program, or the UAP requirements, and a return to duty process before returning to work is set up. The employee is then placed into a follow-up testing program, which can range anywhere from 1 to 5 years, where they're coming in on a specified time frame into one of the clinics to be drug tested. These are tables that just basically give you an understanding of what our rates look like for 2020 and 2021. As you could see, if you break down the different types of categories that I began with, we do a very robust testing program. We tested basically in the federally mandated testing group, which are titles that are defined by the feds, either under FRA, FTA, or FEMSA. We did over 26,000 tests. Our testing rate for positive is very low, 0.47. And when you look at where we're at January to June 2021, it seems to be creeping up a bit, but we're still under 1%. This is the MTA non-federally mandated testing category. There is a policy within the MTA where the agencies define specific titles among our employees that are considered safety sensitive, even though the feds have not defined them in the titles that they give us. Again, if you look at this, we do a very robust testing in the same testing category reasons. We've done over 22,000 in 2020, and we're on track to probably exceed that for 2021. We have, again, our rates are low. 0.61% and 0.57%. I want to just point out that random column for testing reason, there's only 30 and 22. That's because for the non-federally mandated testing populations, MNR is the only population that has defined titles that are some supervisors that oversee federally mandated employees. There's a very small population of them. They set up when they pull them in. Usually the pool is brought in 1 or 2 people per month, and that's why the number seems so small. The other side of the house, for all the other agencies, we don't have a random drug testing program for the non-federally mandated employees. And then each of the categories, the testing is done by title and by the different pools for the feds. So we stick to the same program for that population. So here we wanted to just give you a comparison of what the MTA looks like with the rest of the nation. And as you can see, we are far below what's happening nationally. And in some categories, we exceed, we do very well. We also, since we do so much testing in a year, over 50,000 tests are done in a year, we tend to keep the rest of the nation's rate lower. For that, I think the rest of the transportation industry is very happy with. But again, we are really the leaders in this. We do the most testing across the nation. When you look at the federally mandated positivity for the non-federal mandates, you also see again that we are pretty low compared to the rest of the nation. In some categories, you know, our random drug testing is it's 0% compared to the rest of the nation. The non-federal mandates, did we go back? It's okay. One more. That's it. The non-federal also, this is that population where we as a company, MTA as an organization defines the titles. Again, we are far below what the rest of the nation is seeing in terms of positivity rates within the organization. So that's my summary.
Any questions for Dr. Luisi? So before I call on Commissioner Zuckerman, who I think has a comment, I'm sorry? Norman? Okay. Let's just go back to the New York City Transit Agency plan. The Safety Committee should approve and recommend that to the board. So can I have I'll make a motion to approve the New York City Transit Safety Plan. Do I have a second? Second. All in favor? Aye. Thank you. Plan passes. Commissioner Zuckerman.
Thank you, Pat. So look, the other Pat, you've done an amazing job over the last year since the last time I saw you. I mean, you went from being the safety officer to, I don't know what your role was titled, who cares what the title is, but what you organized or orchestrated was extraordinary. And I dare to think about what would have happened to the public and the employees without your efforts. And I think your undergrad degree and training is what led you to that great skill. But I want to go back a bit because now, despite the Delta variant and God forbid what is recurring, this safety committee has an opportunity to reconceive itself again. We haven't convened in a long time, and clearly there's very few people here, so we have a chance to talk about this. The history of the safety committee, I've only been on this board now 7 years, so as I recall, the history was it was basically formed out of spite and Dival, and the chair at the time said, I'll be the chair of the committee because I want to prove that it's really important, and the committee met to talk about that accident and the extraordinary explosion of accidents that occurred at that point. And then we became a committee that basically just reviewed the aggregated statistics of each of the committees, and it wasn't that productive. And your predecessor had tried, and I thought it was thoughtful to talk about, I forget the acronym, but it was some acronym about like total safety system or something very innocuous like that. And I had found for some time we weren't really, we hadn't really started thinking, and you and I had lunch, I think, right when you started, or breakfast, and we started talking about what can we do. So I think as God willing, COVID wanes, we have an opportunity, and under Pat's successor, to think about what the purpose of this committee is, which I hope is more than just summarizing what the individual statistics are of the individual authorities. And whether that's focusing on major issues that are occurring, whether that's focusing on what the doctor just took us through, which is individual topics, or it's my general concern, which is what are those things that the individual agencies don't have time to focus on, so we can take the camera lens back and think of the bigger issues, issues that no one agency can bother to think about because they're operating on a day-to-day basis. I just want you to put a tiny bit of brain space, 1 or 2% of your capacity, to think about how do we reconstitute ourselves to do something that's not just a regurgitation of what the individual agencies already talk and do in their committees, which we're going to have now back in form. So just a thought to that, please.
It's a great point, and I'm sort of grateful as if there is a silver lining to COVID, which largely there isn't, but it caused a great coalition or us to come together, coalition as a safety group, and really start to not only manage, at the agency level, which is really important, but provide that kind of oversight and resources and direction from the headquarters and as a group, so that we were very consistent in what we were doing. Everybody had the right thing. So to your point, I think we're ready to really step out more briskly on that point.
Andrew?
Yeah, to Neil's point, this is actually Safety and Security Committee, is it not? Or is there a separate security committee that deals with issues of anti-tunnel intrusion systems, anti-terrorist types of things? Or is this the body that does that as well?
So there is no quote-unquote security committee, but to Commissioner Brown's point, I think that we're looking at that as an option, and we'll have to come and discuss it with you, and because there's some protocols that have to change. We have in the past talked about some security things in committee, but they are usually around the purchase of technological equipment, usually CCTV cameras and alarms and things like that, right? So they have been discussed in.
And hardening of underwater tunnels, things of that nature.
Right. Yeah.
Commissioner Brown?
That's got to be part of this.
Yeah, first of all, congratulations on statistics. They, as far as numbers go, though some of these are very small numbers, and it's hard to read good data in very small numbers, but, the statistics look great. I do have a couple questions, though, about how you're going to proceed going forward with regard to pre-employment screens and COVID status. Do you have plans to do screens for COVID vaccinations and COVID status in the pre-employment?
Right. So currently, we have seen an increase in some of our pre-employments coming in with the new hiring uptick. We are asking every pre-employment if they would like a vaccine. We have an operational clinic over at 130 Livingston Street. We've gotten and secured supplies of Pfizer and J&J. Often the new pre-employments have already gotten vaccinated. We have also noted in our charts when they come in. So our first setting that we have, we could screen 7,000 people that come in through the drug testing program. Maybe 50% make it to the pre-employment screening, which is the real physical. So when they're coming into the clinics, we are asking, are you vaccinated or not? And then if you're not, would you like to get vaccinated? We have a lot of protocols in our clinic where you have to be 6 feet apart. We're not allowing a lot of people in. We are only allowing a certain number so that we keep our own employees safe from the outside until those folks become our employees. So we put a lot of protocols in place for safety. We can't mandate that they get the shot at this point. We hope by the end of September, there may be a mandate, and then we would go forward and say, you all need to get the shot, you know. So we're dealing with that from a safety issue, from a masking issue. Security's there to help us to not allow a lot of people into the clinic at once. They have to wait outside, actually on the street, in order for us to keep the flow and to keep our employees that are in the clinic safe from pre-employment.
Yeah, what keeps you for screening for the antibody status in the pre-employment?
In the
What-
pre-employment group?
Yeah, what law or what consideration?
It's not something that I think we have thought about in terms of looking at the general public that are applying for positions. We could consider it once they pass the drug test, and we now get them in for the pre-employment screen, which is the physical with our physicians. If we would like, we could set up something with BioReference, they're on site. BioReference is doing COVID testing. That's something we also offer anyone coming into the clinic. We'll cover that. We could consider looking at the antibody if that's how we want to go. I think it's a good idea.
Bob?
I'm all about testing and screening, but we have to follow the employment rules that we have set up.
I have one more
Yep.
in that regard, and the effects on nobody likes to get tested. On the other hand, people appreciate, I think, nobody likes to work with a drunk either. But when you look at the reasonable cause results, I mean, when you're kicking up 2% out of 100 or something like that for the for getting a positive result in a reasonable cause, and this is what our members feel. It's not necessarily how I feel. Maybe 2% is a useful number, but they feel picked on if if you're not finding. I mean, how reasonable was the cause if only 2% of the people? I mean, I don't want anybody screwed up while they're working. However, how reasonable was the cause, and have you done any research into what really drove these people to be sent for a piss test?
Right. So reasonable cause, there's a checklist that the supervisor has to follow. And that checklist is actually developed by the feds, and that's what's used. I think we could improve training with supervisors to be more aware of what reasonable cause is, reasonable suspicion. Yeah, I think the 2%, we're working on making sure that that is accurate. Whether it's below or whether it's too high, that's something that we're going to have to focus on, especially as legalization of marijuana comes into play. How will a supervisor note that a person is impaired because they smoked pot last night or they took a gummy or whatever else is coming down the road? So we are focused on that at this point. I could get back to you on it when we look a little bit more closely at it to see if there's areas we can improve on. We created an electronic form, which I think will make it easier for a supervisor to fill out, which would then come into the clinic for our folks to review prior to the employee showing up, to make sure that it meets the federal guidelines, and to just speak with the supervisor on what their decision-making was in identifying this employee. I think it's an area for improvement.
Bob?
Thank you.
Yeah.
So let me pick up on a series of comments that my fellow commissioners have made. First, on the statistics, the chart you showed actually showed that in non-federally mandated positivity rate, U.S. is about 35%, when we were 2% last year, 1.6% last year, and then 2.8% this year. So it really does suggest that some training and some conversation about who you select and what are the criteria to select really would make sense, which then gets me to sort of the role of the committee that Neil raised. And I think I've been hearing, and I've expressed, and many of my fellow commissioners have expressed, a desire for the committees to deal on substantive issues in a very serious, deep dive way. Certainly, where we go forward on COVID is an example of that. I mean, we have had such an extraordinary impact of COVID on the workforce, and we've demonstrated how life and death the issue is. Where we go forward is something that I think would be a perfect example of where this committee could have an in-depth conversation and perhaps have some serious recommendations to locally, the state, the nation, in terms of our thinking about that. And so I really would like to reiterate the desire for us to not just review mounds of data, and at least the safety committee only looked at 31 pages as opposed to the 4,000 that gets others, not to deal with reams of data, but to take a few substantive issues, have an in-depth conversation, have an in-depth debate about what we should do, and have some meaningful input. And I really would very much favor it. I think there's a hunger for that among the board commissioners.
So, Dr. Luisi, you mentioned that you're not ready to have a mandate for people to be vaccinated. What would it take for that mandate to actually come?
So I don't have that authority. I think what's happening at this point, because the vaccines are still under the emergency authorization, we've been told from feds that they're hoping that we'll see some FDA approval of the Pfizer, the J&J, the Moderna by the end of September. If that happens and there's a FDA approval, then I think it will move to be mandated. So I think for us, we have to wait for the federal and the state to provide us with that.
So you probably listen to the news or read the papers right now, and it is a hot topic out there, and it not only affects us, it affects many industries that I believe are just waiting for that to be triggered so that they can then mandate it within their workforces or whatever their community is.
Thank you.
Just a quick question. In the presentation, you had talked about after a positive test that there's an interview with OHS. Is that a panel of people? Is it just one doctor or?
It's usually with the MRO. The medical review officer is a certified physician that looks at the test results, right? And when I say verified positive, that basically means that person may be positive because they're on a pharmaceutical prescription. And then the MRO, if it's a pharmaceutical prescription, will talk with the employee, talk with the employee's physician to see if there could be a change in that medicine that would not contradict what we need to do for the federal side of the house, right? So there is a one-on-one with the MRO. If it's a safety-sensitive employee, it's usually the union person's in the room with them, and then we bring in the EAP. So there is a discussion to make sure that the verified positive is truly a verified positive.
And in some cases, because I've seen more of it of late, where it's a family sharing a prescription medication, which shouldn't happen. Yet, if it's explained, like sometimes if they're not medications that alter someone's ability to work, if there was wiggle room with that.
Yep.
There seems to be more of that not every failed case is abuse or something.
I agree with you. I totally agree. There are prescription drugs our employees are on that it's valid for them to be on it. What the physician will try to do, though, there's a panel of the type of drugs that we have to test for. If the physician can move that employee from the drug that's being picked up on the panel that the feds have said we have to test for, they make every effort to get them to move to a different type of medication, right?
Thank you.
Yeah.
Any other questions or comments? Commissioner Brown?
Yeah, and it has to do with the sort of workload question. Is there any plans by the mothership to replace Pat at the head of this committee? I mean, it seems to me you have sufficient jobs. to keep a guy busy. Not that you're not doing a quality job here, but, you know, when it comes to overwork, it's one of the first things we look at in an accident when something occurs on the property. And you being at the top of the food chain and doing several jobs, I'm not quite sure how many, but when you initially came here, this was your single focus. Is there a plan by Dispat or Jano or whoever's in charge of this place tomorrow to relieve you of your responsibilities here? You have a lot of qualified people that can take your place.
I think that, you know, I'm certainly not one to know much about any of those machinations, but I'm certain that something's going to happen here in the next few days, and then we'll all be able to see where it all comes out, you know, ends in the end. So I think something will happen.
Andrew?
You may recall way back when we had a topic of discussion about how certain navigational apps were misdirecting motorists onto railroad tracks, Waze and the Long Island Railroad come to mind. I seem to recall that. Are the navigational apps updated by the maker, or do we update them when we remove a grade crossing, or we install a grade crossing and change what the navigational routes are in a given area?
Initially, all the initial data came, you know, GPS data came from us to them so they could, you know, get it into their system. You know, clearly they have amazing systems that go out and map, you know, the planet, right? And so they know where things are. The fact if we remove a grade crossing, I do not know at this moment. I'll find out if we actually send them information. But again, I do think that their own systems catch up with it, whether we say it or not.
Hopefully in a time-sensitive manner, though.
We'll find out.
Thank you.
All right, good. I'm going to make a motion to adjourn. Do I have a second? All in favor? The next meeting of the Safety Committee will be in October. Thanks, everybody.